Well, hey guys, welcome back to my channel. Today we're going to be talking about Mounjaro. Mounjaro is a medication used for type 2 diabetes to help lower blood sugars in conjunction with diet and exercise. We're going to be covering how to do the injections with the demo pen and then just a little bit of background behind it. We start with a dose of 2.5 milligrams per week. You inject it once a week, and then every 4 weeks we have the option of increasing the dose. So 2.5 milligrams once a week for 4 weeks, then increase to 5 milligrams once a week for 4 weeks, then 7.5 once a week for 4 weeks, then goes to 10 milligrams once a week for 4 weeks, then 12.5 milligrams once a week for 4 weeks, and then 15 milligrams once a week is the maximum dose. The typical side effects of Mounjaro are most commonly GI related, especially queasiness, nausea, in rare cases vomiting, indigestion, constipation, diarrhea, gas, or bloating. Those are relatively common symptoms or side effects, but the good news is that most of the time, if you stick with the medication, as long as the symptoms aren't too severe, after a couple of weeks they subside. If you have a history of pancreatitis, multiple endocrine neoplasia type 2, medullary thyroid cancer, or moderate to severe gastroparesis, those are contraindications to Mounjaro, and we would not want to use it in anybody who has those things. So let's get to the dosing and how we do the injections. Whenever you get your pens, the nice thing is that the needle is kind of tucked away inside the pen, and so you actually don't even have to see the needle at all, so it's pretty easy. You want to make sure that you wash your hands before you do your injections. The places that you can inject are anywhere around the belly button, but it has to be at least 2 inches away from the belly button, around that area, the backs of the arms, or the front of the thigh. You want to make sure that you're rotating your injection site. You can pick the same injection spot in the body, like on the abdomen every week, but you just want to do a different place as you're rotating around the belly button, at least an inch or 2 away from where you injected the week before. You inject on the same day every week. It doesn't have to be the exact same time, although it's a good practice to do it at the same time every week, because that kind of will help you to remember. If you do forget to take your injection, as long as you take it within 4 days of the normal injection day, then take it as soon as you remember. If it's past more than 4 days, then you'll want to just skip that dose and then resume on your regularly scheduled day. For example, if you normally inject Mounjaro on Mondays and it's Wednesday and you remember, go ahead and take the Mounjaro on Wednesday. If you normally inject on Mondays and Saturday comes along, then skip that dose and resume on the following Monday. Okay, so with that, let's get to exactly how we do it. There's 3 steps: pull, place, and press. So if you look at your injection pen, it comes with a gray base cap at the bottom. You're just going to kind of firmly just pull that off straight down, and that's going to come off, and you're not going to replace it at all. So that you just put aside. Then you're going to place the clear base against your skin in one of those 3 injection sites that I had mentioned to you. As you can see here, you're going to normally would just place that against your skin, and then you're going to want to, at this point, unlock the pen. So you can see here that it says that it's locked. This is placed against your skin, and you're going to twist this and turn it to unlocked. Then from here, you're going to press. So this purple end here, you're going to press it. And when you do this, you'll be able to see here that the injection is going to go. You're going to hear 2 clicks. On the first click, that's when the injection has started. On the second click, that's when the injection has completed. So you can see here, it's going to take about 10 seconds. And that's it, voila. The whole thing is completed. Again, just make sure that you wash your hands prior to administering Mounjaro. As far as storage, it needs to stay refrigerated prior to use. You can take it out of the refrigerator for up to 21 days and still use it in case you need to travel or are in a situation where you do need to remove it from the refrigerator. It is good for up to that amount of time. After that, you would need to use it discard it and use a different one. You also want to make sure that you're taking a good look at your pen before you give your injection, just to make sure that there's no that it's not cloudy, that it's not frozen, and that it's not expired, and that you have the correct dose. And that's all there is to it. I hope this video was informative on how to do Mounjaro injections. I'm Dr. Villavicencio with Endocrinology, helping you to find your perfect balance. See you again next time. Hasta luego.